Regenerative Medicine Institute researchers are working in conjunction with world-renowned research institutions in order to more efficiently deliver stem cell therapies. We feel this kind of collaboration is key in advancing the science and making it more widely available. Each of our treatment protocols has been peer-reviewed and approved by an independent review board. Our scientific advisory board includes physicians and researchers from prestigious and renowned teaching and research institutions all over the United States. The difference between the Regenerative Medicine Institute and other stem cell therapy providers lies not only in the efficiency of our treatments, but also the setting in which they're delivered. As opposed to other groups which don't have access to emergency medical services, an operating theater, an ICU, or a large medical staff, all of our treatments are provided in one of the largest private hospitals in Mexico. We have 12 operating theaters, a staff of 150 doctors, as well as a 24/7 ICU and ER. Each of our 27 different treatment protocols are overseen by a specific specialist in the field, as opposed to having one physician treating a variety of diseases, regardless of whether or not he or she is trained to do so.
Hi, my name is Dean Stokes. I live in Sunnyside, Washington. So I was here for one day, then they started the procedure, and the procedure was a stem cell transplant and the stem cells were injected into my heart. And it went very, very quickly, very smoothly. I was put out for it, and I just have a vague recollection of them telling me when to breathe and to hold my breath. And they worked on I guess the lower quadrant of my heart, and they injected it in 17 different places. Protocol said that they only had to do 16, but they had a few extra stem cells. So, I'll say they gave me the whole vial. I had an echo sound done the day after, and my ejection fraction prior to the stem cell has slipped down to a 32% ejection fraction, which is plus or minus, so it was the same as after I had my MI, and today it was up to 37%, which really made me feel good. I only have one chance basically in life, and I talked to her with my wife, many times, and we thought, if you don't do something and you save the money, what good's it going to do you? You're always going to wonder, if something happens to you, what if? And I'm looking forward to going back home to my family. Geez, I thought the facilities, the physical plant is second to none. I mean, I've been in a lot of hospitals, and it's an extremely modern facility. It's clean, it's well staffed. You press the button and someone's there right away. You'll find that a smile and a friendly face will go a long ways. The doctors all spoke English, had no issues whatsoever there. I had a very pleasant experience. It was just a win-win situation. And I would recommend it to other people that unfortunately find themselves in my position.
We are a multi-specialty group of board-certified physicians and allied health professionals who work together to advance the science of stem cell therapies and make them available to patients around the world. We've recently been invited to participate with ASCR, which is a large network of research facilities, including universities and private laboratories, all dedicated to the study of stem cell therapies, all sharing research and experiences, which we plan to do as well. Due to our commitment to patient safety, we've submitted to review by ICMS, which is the International Cell Medicine Society. This is a group dedicated to holding clinics to the highest standards of treatment as well as scientific review. To date, we are the only clinic that has met all requirements set forth by ICMS. While this is still an ongoing procedure, we are the clinic that has gone furthest in the review process.
My name is Dean Stokes. I'm from Sunnyside, Washington, and I am visiting the hospital here for a checkup. I'm a coronary heart patient, and my age is 62, and like I say, I'm here for my 3-month checkup. When I first came to this hospital, I was down in the dumps. You know, my cardiologist in Washington said, you know, take these pills and come back and see me for the next appointment. And I chose not to do that. So I got involved with the Regenerative Institute of Mexico, and I've had a stem cell transplant, and the results have been fantastic. I started out, like I say, with a 32 ejection fraction, and today I had a 49% ejection fraction, which is absolutely fantastic. I have a new lease on life. You know, my wife didn't want to come with me because 20 years ago we came down to Tijuana, and she was horrified. And my first trip down 3 months ago, I was really impressed. And this trip down, I had a chance to drive around a little bit and see some of the sights, and I really was impressed. This town has really cleaned up its act. You know, myself, I worked hard to get my 49% ejection fraction. I did a lot of exercise, and I followed all the instructions that I was given. I cannot thank them enough. I would definitely recommend it to my friends. But likewise, I've told my friends, hey, take care of yourself. You know, eat right and exercise. This has been a blessing. And one of the things I noticed in the office, it said, the future of medicine, here now in Tijuana, Mexico.
I'd like to thank you for taking this time with us. For the Regenerative Medicine Institute, I'm Dr. Jesus Perez. For more information, please visit our website. Thank you very much.